I'm Katy Whalen. I am the founder of Joy Women's Wellness, and I started Joy based off my own health journeys. And really, the mission is to help women feel better, and we do that by providing education and access and data on yourself. So today, I'm so excited for you guys to meet Kimberly. She is one of our team leads. She's very functionally driven, comes from a holistic kind of viewpoint when it comes to health because everything, as we know, is intertwined. And then Meredith, I love Meredith, a good friend of mine, and she has been with us for a little over a year, and has been through the process, done all the things. So Meredith, you can also say hi and kind of talk about that a little bit too.
Yeah, hello everybody. Yeah, it's November will be 2 years.
Oh, 2 years. Holy moly, that's amazing.
Holy moly.
And I mean, you look amazing, and I know you're feeling good, and you do all the things. So it's really cool to have someone that, walks the walk and has been through it all. So
Yeah, and I
thank you
I
for
can't
being
wait
here.
to hear, thank you. And I can't wait to, you've changed my life. I said it on the last webinar. Meeting you was not thank the good Lord above. It was not a random, meeting. It was meant to be, and it put my life on a completely different trajectory.
Mm,
And so I think it's going to be, these are great. I think that it's, going to give women a lot of great information. I can't wait to hear Kimberly's expertise on thyroid because when my eyebrows fell out at 35, I can tell you I had no idea that it was my thyroid, and I was eyebrowless for quite some time until I tattooed these suckers back on my forehead. But yeah, so I think it's great. So I can't wait to hear what she has to say and the questions everybody has. So yeah, let's do
amazing.
it.
I did not know that story. That's you always bring something fun and new. So thank
Yeah.
you.
These aren't
Um,
real, ladies.
they look good.
Look good. So whoever's doing them is doing a great job. I always look at women's eyebrows because I'm constantly like, can I make mine better? Like, what about are they real? Are they not? Yours look real and are perfect.
Oh,
So
good,
They
it's
good.
awesome
are.
that you're doing.
And
So I'll just introduce myself. I'm
yes,
Kimberly
absolutely.
Brown. I'm a team lead provider with Joy, and I am super passionate about thyroid. So I'm super excited to be here today to talk about that. But I've been a nurse practitioner for gosh, 15 plus years and actually really pretty and been in healthcare 20 over 20 plus years and actually really didn't like it until the past about 6 years because I was actually finally doing what I like to say preventative medicine or optimization medicine instead of more like sick care. So I love now being a nurse practitioner, and I especially love the world of hormones and thyroid and all the things that we get to offer our patients at Joy. So that's me. Like a lot of providers that come to this space over from more conventionally trained. I also was like a complete hormonal mess about 6 years ago and took a lot of time to rehab myself just by self-educating and kind of changing up diet and supplements, and then experienced started hormones, and I've kind of now I'm on every hormone there is. I am in the middle of perimenopause. I don't have a uterus, so I got to do my blood test again. But I feel great. I'm on a lot of things. So I also um, can share personal experience and then along with professional. So yeah, so I'll get started chatting about thyroid. I'm excited to answer questions too. So you guys don't just have to hear me talk, because
Yeah,
that's
let me just say, everyone, go ahead and put your questions in the
yeah.
chat, and then Kim will start. We have a few questions kind of to start with. Kim will go over some basics, and then this will just be conversational. So go ahead and make sure you get your questions answered.
So, I'm not going to bore anybody with like an anatomy lesson or like a lot of pathophys, but just basics. Your thyroid gland is kind of right here in the front of your neck. And I think that's important to know because some women I'll like visibly see that their neck is enlarged on camera. And I'm like, have you gotten your thyroid checked? And they're like, yeah, I've been told it's fine, but like, that's really not normal. You would want to get an ultrasound at that point. But anyway, it's right here in the front of the neck. It's kind of a butterfly shape. And it is a gland that is literally responsible for pretty much everything in our body. That is another reason why I'm super passionate about it. Like it controls everything. I think probably most of you are familiar that it helps us regulate our temperature. So a lot of people know that if you feel cold all the time, it might be a thyroid problem. Usually that's associated with low thyroid function, or if you're really hot or have like a heat intolerance, that can be associated with too much thyroid hormone, so hyperthyroidism. But it does way more than that. Metabolism is another big role that the thyroid has. I would say probably the two top symptoms I have women that are struggling with thyroid have either weight gain or weight loss resistance. And then fatigue is the other one. People do feel cold, but it's really not as common as you would think. The top one is fatigue, almost always. And it's usually described as like more exhaustion, or I need to take a nap at like 11 o'clock or 3 o'clock, or sometimes people can make it to like 7 and then they're crashing, but it's not like a normal tiredness. Um, Brain fog is big. Low libido is a big one. Yeah, doing all the things, can't lose a pound or suddenly gaining weight and you haven't changed, your nutrition or exercise or anything like that. So those are probably the most common. Trouble with focus. I see also a lot of women, I feel like lately are being put on Adderall, which is very interesting. And so I have to wonder, I feel like, okay, maybe some of those people need that, but a lot of times I think that it really could be that your thyroid is not optimized.
How do
And
you, can I just ask while you're like all those symptoms also sound a lot like hormone stuff too. So like, I mean,
yeah,
thyroid's a hormone too. So like, but how do you
yeah.
distinguish or how do
Well,
you
you
know?
don't always know. It's tricky. I mean, that's why like getting with the right provider and getting a comprehensive blood test is super important so that we can look at everything together because it does have a tight relationship with your sex hormones. So that's your testosterone, progesterone, and estrogen. It also has a really tight relationship with your adrenal health. So usually if I'm treating thyroid, I'm going to also be treating adrenals. So they have a really close relationship. So we do have to look at everything. And we don't always know. I tell all of my female patients there's kind of 6 key players or systems that I'm looking at trying to optimize. And we just kind of start with a couple because we don't want to throw too many things at you at once. And then we meet again and we're like, okay, what symptoms are better? What's not? And that kind of drives where we go next or how aggressive we are with certain hormones. So, sometimes when I'm starting out with thyroid, depending on the patient's symptoms and whatever else they might be deficient in, we might start with some testosterone or progesterone, for example, and maybe some nutrients that the thyroid needs to increase production, some sort of supplements. And then we revisit. And if they're like not really a lot better, and we know that their progesterone's now optimized or testosterone's optimized, then it's like, okay, well, then we probably do need to be a little bit more aggressive with thyroid and it's time to consider some replacement. I really look at it as just another hormone that we're replacing, just like we replace testosterone, estrogen, and progesterone. People get hung up on that and like are a little bit more hesitant to start it, which I understand because the other hormones in theory, if you wanted to stop them, we're not going to be like, you're probably going to return to your baseline, but you're not going to be worse off. You're going to produce them again, similar to the way that you were, but I mean, unless you're in menopause, obviously. I'm talking about perimenopause, where you still have some ovarian function. Thyroid replacement, potentially, if you're on it, for a while, your body becomes kind of more reliant on it, and you do have to
Mm.
actually take it for lifelong. So it's a commitment, which I totally understand, but it's really super important to be optimized on. And I think the commitment's worth it if you feel a lot better.
If you can't fix it in
Yeah,
with
you
other
can
ways.
fix
So
it.
like if it's like
Or if you're
if you're
like,
just trying to improve it,
oh,
you can try other things, lifestyle supplements,
oh, absolutely. I
other
mean, we'll get
things.
into the different kinds. Like Hashimoto's is definitely a little bit different, where I might be a little bit slower to put people on replacement. I mean, I really approach it like any other hormone. Like it depends on your symptoms. It depends on how tired you are of feeling not well, and how ready you are to feel better. I mean, it's like a lot of things. If your thyroid function is so down, like you can't necessarily always eat your way out of it or supplement your way out of it. It's kind of like menopause, like it's going to happen. You
Mhm.
can't keep your ovaries working forever. You can help them, but at some point you just might need the replacement.
That makes a lot of sense.
Yeah, but it really is individualized for everybody. And obviously, again, we try to decide that based on the patient's comfort level and what they're, how they're wanting to approach their care.
Mm.
Yeah.
Misty's asking if how she gets her doctors to listen to blood work results, and I've got an
Girl,
answer for that. I'm going to say get a new
yeah.
doctor.
Yeah. So I'm glad that question's brought up because that was one topic that I wanted to bring up. And I'm not here to badmouth conventional providers. I will say our medical system is amazing for acute care, but it really does stink for health optimization and preventative care, which really is unfortunate, but that's just where we are right now. So for thyroid, and I'll put myself in this category. The only reason I'm more comfortable with thyroid is because I have gone out and taken every webinar and read books, and it's self-education. I mean, I've taken like actual like certifications, but I mean, the point is it's all been after my like regular education. And the same goes for physicians, physician assistants, like anybody like barely gets education on thyroid in their regular program. Even endocrinologists, I've heard from like holistic endocrinologists that said that their conventional training, it's minor. They're basically told to look at TSH. Endocrinologists might look at a free T4, but they're not even really looking at antibodies very often. But conventional providers forget it. They're not doing a full thyroid panel because they're not taught how to read it. So they don't want to order it because they don't know what to do with the information. It's not because they don't want you to feel better. They just literally don't know. And they're also told to only prescribe T4 based medications. And they are told that T3 is bad, which is ridiculous, but that's what they're told. So that's what they do. So you have to find people that are knowledgeable and willing to run the full thyroid panel because they know what to do with that information. And
Yeah, and we hear a lot like, "Oh, I've already checked my thyroid," and you have to dig deeper and go, "Is it just TSH you checked, or
so
is it a full?"
yes, exactly. So just this morning, I had a patient that has been on levothyroxine, which is a T4 based medication. So T4 just means you're inactive thyroid. Okay. And I forgot to bring my little diagram, but I have a little diagram that I show a lot of my patients to try to understand what your body has to do. But we produce, so from the gland right here, you have T4, and that's inactive. Um, and then you have to convert that to free T4, still inactive. And then from there, you have to convert it to free T3. And that's what goes out to our cell receptor sites and tells our cells, our body what to do. And so some people don't produce, and so they're low in both free T4 and free T3. Some people produce okay, but they can't convert. So either way, you're still going to feel like you have low thyroid symptoms and you need support one way or the other. Um, so no, now I've lost my train. Oh yeah. So this patient that I had, she had been on levothyroxine, so just T4 for 10 years, and she still had debilitating fatigue, um, anxiety, depression that had gotten pretty worse, and joint pain. Actually, joint pain is another somewhat common symptom of low thyroid. Um, and she was like, I'm not any better. And I'm tired of this. I want to be better. Why I can't get anybody to listen to me. And they're basically just telling her that that's how it is with hypothyroidism. Like, this is the best you're going to feel. And so we had a full thyroid panel. She did our advanced panel, and her free T4 was optimal at like 1.5, but her free T3 was really low, like 2.3, still low normal, so still in the normal range, but really low. So she was really unbalanced. So she's not converting at all. So she needs T3 medication. She wasn't on a lot of T4, so I left her T4 there for right now. And I'm just going to add T3 first and see how she feels. So that would be leothyronine is the generic of T3 based medication. And then we'll follow up and we'll go from there and see how she's feeling. Yeah. Yeah. So,
I think I have an
um,
optimal ranges thing. I'm gonna look for that and put in the chat because I know that's a
yeah, it's a
question.
helpful guide. There again, I think this is what makes hormone treatment so difficult. It's really also heavily just on symptoms and how that individual feels. Like we do want to keep levels safe. I mean, yes, you can having a lot of too much T3 can be dangerous, but pretty difficult to do. I mean, there are people out there that are also prescribing crazy amounts of T3, which is concerning and scary, and not really testing it and talking to their patients. But um, low and slow is the way to approach thyroid replacement, and doing small increments until you're at good levels and your symptoms are gone. But there again, like Katie brought up earlier, it's also like we have to look at all of the hormones. So we all still have to think about progesterone and estrogen and testosterone. And like I said, adrenal function is incredibly important with thyroid function. In fact, if your adrenals really are, you've got like adrenal fatigue, for example, and I'm trying to give you T3, you won't tolerate it. So I don't know if anybody out there listening has tried T3 and they had like palpitations or they felt more anxious. They felt heart racing. Sometimes that's because your adrenals also need some love. So because you just can't tolerate kind of that jolt to the system if you don't have that adrenal support in place.
Wow.
So how do we test for adrenals, and what if you figure out that there is fatigue, what do you do in that case?
Yeah, so adrenals are hard to rehab because unfortunately there's not like a magical hormone for them, which I wish there was. So it's more lifestyle, and supplements can definitely be helpful. We have a lot of great supplements at Joy, like just again, similar to thyroid, like they also need building blocks with different nutrients and things like that. There's adaptogenic herbs that can be helpful. I also really like adrenal glandulars, which are like a cow adrenal gland that's been made into a supplement. If somebody really has a lot of fatigue, that can be a really great way to kind of get them back online pretty fast. But a lot of like just kind of stress management, saying no more is a really good way, not over exercising. Those are really two common things I see with a lot of my 40 somethings that are juggling kids and a job and a house, and they're not like slowing down, and their body's like, listen, lady, you got to pump the brakes or I am going to be like full out, just burnout. Yeah.
Well, I think you already answered this, but Courtney says she has hypothyroidism and asked if she would ever be able to get off the medicine.
It depends. It depends on why you have it. Like if let's say you had Hashimoto's that you've never really addressed. So that's an autoimmune thyroid condition. Um, and you haven't addressed like your gut health or food allergies. Your immune system still needs support. And maybe once you did all of that, it's possible you could maybe transition off your medication. I I really, I don't love medication if you don't need it, but thyroid tends to be one that I actually do like medication. And I think it really can be super beneficial if it's done correctly. So, people that don't feel well on their medications, it might just be because you're not on the right dose or the right type. I mean, there's lots of different options. We've kind of talked about synthetics, but there's also natural desiccated thyroid, which the FDA is kind of being a big bully about currently, but I'm hopeful that we're gonna figure that out. But that's like your Armor and P thyroid. I personally like Armor the best, but anyway, some people do better on those. Some people do better on synthetics. Just depends.
So you got to play around. It takes some adjusting.
You really do. You have to follow up with people. You have to get your labs repeated. You have to have that conversation on what's better, what's not. When are you not feeling well? A lot of things need to be dosed twice daily, not T4, but any sort of T3 based medication. Typically, people do need that twice daily because it has a much faster half-life. So some people only take it once a day. So they might feel okay for like the first half of their day, but then they're having a crash. That could be why.
I mean, holy moly, this thyroid seems very complicated. So I will just say, like,
It is.
because of that, it is important to go to someone who knows what they're doing, right? Because
Yeah.
it seems complex to me as someone who's never studied it and listening to you.
So and I don't mind talking, but it looks like there's lots of questions. So you guys tell me if you want me to just
Yeah.
chip away at questions or if you want me to kind of keep going, whatever is more beneficial.
Well, how about I want to make sure the questions are answered. Heather is on progesterone, testosterone. How long before to give those things a chance before starting thyroid?
Excellent question. I would say at least 3 months, it takes, I mean, it can take longer to get really regulated, but at least 90 days, I would say is kind of long enough to really know if you're moving in the right direction or you really need to like bring in something else. Yeah. But I would say it depends on what your lingering symptoms are. Like that, if it's still low energy, brain fog, and low libido, then yeah, you might need to be a little bit more aggressive. It also depends on the type of testosterone you're on. I would say cream um, can take longer to kind of build up to an optimal level than like something like injections. So I would want to know that to also fully answer that question comprehensively. Um, but yeah, and then I would say it would depend on what you kind of feel like you're still struggling with. Yeah.
Amazing. Um,
And the adrenals, don't forget about those. They could be also needing some love.
which
Yeah.
again is mostly lifestyle and supplements.
And pretty much also everybody. Like, I'm sorry, if you're over the age of 30, chances are you need some sort of adrenal love. If you're in your 40s, you 100% do.
Mm, that's sad, unless we're like living on a farm barefoot with no
Yeah, unless
stress,
you like
like
meditate
Meredith was
every
saying.
day and I don't know. I mean, there are some people out there that their adrenals are good, but usually those people have spent a lot of time like rehabbing from a lifestyle point and they are meditating, they are doing a lot of deep breathing, like they're doing a lot of things to get into their parasympathetic state and have been. And that can be really life-saving, and the reality for a lot of people is that you don't either know you need to do that, you don't have the time to do that, or you don't want to take the time to do it, and you just keep kind of going until you can't anymore.
Mm. What does high levels of the thyroid globulin antibodies mean? Kaylee has a
Yeah,
doctor
so
that runs the test but
that's
doesn't
a
take it.
Hashimoto's antibody. So there are two main antibodies for Hashimoto's. There's some different ones for Graves, which is not our at Joy where we look for Hashimoto. So that's your TPO, which and then is also the thyroid globulin antibody. So sometimes you'll have one only be positive, sometimes you can have both. But if you have elevated thyroid globulin antibody, then you have Hashimoto's. So sometimes you can just have what I call Hashimoto's thyroiditis, which means your antibodies are elevated, but maybe your thyroid hormones, so like your free T4 and your free T3, are still in good range. So that maybe means that it was caught early. And even though there's some antibodies, so like soldiers, I like to say, kind of working against your own thyroid gland, it's not damaging enough to where the thyroid's still able to function. So in that case, that treatment is really different, and we wouldn't necessarily jump to thyroid replacement. We would want to work on improving gut health. This is where sometimes like trying to figure out if you have any like food sensitivities, food allergies, um, impairing the gut wall lining. So a lot of times with autoimmune, you have a little bit of what's called leaky gut. You guys have probably heard that term, but more technical term is increased intestinal permeability, which then allows like larger molecules to get out into the bloodstream that shouldn't really be there. And then the immune system gets all jacked and is like, why is this happening? And they kind of get confused and start breaking down cells that maybe look similar to food proteins, and they mistake it for the thyroid. So they accidentally attack the thyroid thinking that they're breaking down like food protein. So common ones are gliadin or gliadin. I think it's pronounced, people pronounce it differently, but that is the protein in gluten. So that's why gluten can be, um, removing gluten if you have Hashimoto's can be really helpful. Casein is the protein in dairy. So I would say those are probably the most common culprits, but it's not the only reason that can be a trigger for Hashimoto's or gut inflammation, but I would say those are the most common. Yeah. So I usually will recommend removing one of those food groups right away, at least for 3 months. And this is not like eat a little bit less of it. It is like completely eliminating it from the diet. It cannot be there at all. For at least 3 months to see if it does bring your antibodies down. Do you feel better? If not, then you can add it back in and do the other, either the dairy or gluten, whatever you didn't start with. I don't usually say do both right away because I think that's really restrictive. Um, and I wouldn't want to do that my own self.
And then
So
it's hard to tell which one made the difference, right?
yeah. Now some people do unfortunately need to do both, but I find a lot of patients are good with just one or the other. But some people do need to do both to feel their best. Yeah. And then there's also something called low-dose naltrexone, which is one of my favorite treatments, and we do offer that at Joy and Blokes. And that also helps decrease inflammation, but It also helps to restore proper immune function. So it is actually a great treatment option for Hashimoto's. Yeah.
And how do they take that? Is that a pill form
It's
or
oral. Yeah.
it's
Mhm.
oral?
And you can take it at bedtime or in the morning. People like take it different times. I personally take mine in the morning because I think it makes my energy better. It makes me happier. It increases endorphins is one of the primary ways that it helps, which is our feel-good hormones. And when we do that, it triggers a lot of natural anti-inflammatory pathways that we have in the body to fight inflammation. And then, like I said, it also helps to restore normal immune function. So it doesn't suppress your immune system, it just helps it act the way that it's supposed to.
Well, I'm upset that I am just now hearing about this
You can
as
pretty much take L-theanine for like a million things. It's fantastic. Yeah.
yeah, I'm gonna be begging for that at my next visit.
Yeah. It's most commonly, I would say a lot of times it's prescribed for Hashimoto's, rheumatoid arthritis, osteoarthritis, but it can help with anxiety, depression.
Well, I'm a Hashimoto's girl. That's why I'm asking this one specifically.
Yeah.
Well,
So
Meredith, you don't have to beg.
yeah. Some people can take it at night, or some people take it at night. The thought behind that is that we naturally increase endorphins around like 9 p.m. to 3 a.m. So you kind of are kind of boosting that natural
Oh.
release. But I, a lot of people in the wellness space are like, nope, you can take it in the morning. It works just fine. Like I said, I take mine in the morning. I feel great on it. I did try it at night and I had one bad night of sleep and I was like, nope, I'm not going to do this. It's supposed to be temporary side effect. So in theory, it should be gone over a week. But if you're like me, like I cannot handle not sleeping. So I was not willing to even wait a week. So I just moved it to the morning and it works great.
That's awesome. There was a good question in here that I wanted to highlight because well, they're all good questions, but one caught my eye, and it was I think Heather talked about how she's been on testosterone and started all of her supplements about 4 to 5 months. She's been taking her different meds, but she's not seeing a weight loss. She's tried Mediterranean diet, but she hasn't looked at her thyroid yet. I
Yeah.
guess she wants to know is should she be hopeful that the thyroid could be the weight change for
Yeah,
her?
you absolutely could. Yeah. Yeah, that's like very common weight. I would say she has weight loss resistance where she feels like she's really trying to dial in everything and she's not having any luck. So yeah, I mean, I would say I tell if anybody is struggling with weight, you definitely want to do our advanced panel at least. We also have the comprehensive, but that's going to give us a full metabolic picture to make sure you don't have like insulin resistance. We want to look at your inflammatory markers and then obviously a full thyroid panel as well. Yeah.
For the adrenals, are there any markers that you test for
Oh,
that?
yeah. So, and yeah, sorry, Meredith, I think you had asked me this earlier and I just skipped right over it. So on our advanced panel and comprehensive, we do a DHEAS and a cortisol level. So those are the adrenal hormones. Now, cortisol does have what's called a diurnal pattern. So it's supposed to peak about 90 minutes after you wake up and then should slowly decline throughout the day and be the lowest at night so that we can sleep and then melatonin kicks in. Um, so when we're doing it in a blood test, like it's just that one point. So there again, it's helpful, but I do lean in a lot into symptoms as well. And just hearing like what people have going on in their life and what they have had going on in their life instead of asking some of those history questions. And that helps to kind of determine how aggressive we might need to be. Because some people might be lower in the morning and then they actually go up at night. So they have an inverse pattern. Some people are like low all day and they're really exhausted they never have a peak. Some people have a really high peak in the morning and then they have like a super steep nosedive and they feel that. So
Mm.
um
We're
there
a lot of questions on, I think there's a weight loss resistance theme here. I mean,
yeah.
Stephanie is talking about it,
It's
Hashimoto's.
really common. There are lots of reasons why women have weight loss resistance. So it might not be your thyroid, but it is a very common symptom, I would say. That and fatigue, literally pretty much every female that has low thyroid function, they have those two symptoms.
And you
So
look at insulin, sorry, you look at
no,
insulin levels or fasting insulin or. Eight.
Yeah, like so, because also insulin's a big one for weight gain, particularly if you're feeling like your weight especially if your body composition has really changed and you feel like you're putting more like fat on. Insulin tells your body to store fat. So I do really like to get a fasting insulin. And it's also really inflammatory. And if you're inflamed, you're also going to have a hard time losing weight.
So, and all from a patient here who's been doing this, like I said, I can't believe it's going to be almost 2 years. I started at 143 pounds
Hmm.
with low testosterone, um, meh estrogen, no
Okay.
progesterone. I had a hysterectomy at 38. So I was coming in with one wonky ovary,
Mhm.
right? That was all I had left, and no testosterone, like none at all.
Negative.
So when I started, and it took probably, I'd say, 4 weeks to start feeling effects of being like,
Mhm.
oh, like
Okay.
there's a libido. I
Are
haven't seen
doing something. Yeah.
yeah, I haven't seen you in years. So
Right.
like all these things started to work, but what I will say to somebody who's going, when is this weight loss going to kick in? I'm on the thyroid meds. I'm going to ask about this new one at my next appointment in September, but I'm at 128 now, but it took to this point of I stayed on my 5 days a week of exercising, and I'm talking yoga and HIIT classes of 30 minutes a day. That's it. I didn't ramp up exercise. I didn't change the way I exercise. I didn't drastically change the way I eat. I just am now getting parts and pieces of the puzzle put back together. But this was not an overnight transformation. This is now coming into a 2 year mark of my body is starting to do the things I'm asking it to do because it has the things that it has been asking me to get it, if that
Absolutely.
makes sense for the
Mhm.
women that are in here listening to this, because it is not, you can't show up to one of these appointments and go, give me the one thing that's going to make me feel better. Because I can tell you it won't be one thing.
Yep. You're exactly right. Yeah. Yeah.
Thank you.
Yeah, no, it's true. I mean, I try to tell my all my patients that like we're going to get you there, but it's going to take a little bit because females are just way more complicated than males. We just are. And we got a lot more moving parts. And
I was
we're
just going to ask, do we have more parts? It feels like we do.
we certainly have more hormones. I know that much.
Okay.
More brain cells? No, I'm just
Ooh.
kidding. Okay, I want to answer Melissa's question because she's saying her joy provider says one fasting insulin level isn't insightful, especially when HbA1c numbers are normal. Make it make sense, please.
Yeah, no, I hear you on that. So fasting insulin it does give us a little bit more insight than fasting glucose, but it is nonetheless one point in time. So when I do see a little mismatch, one of my favorite things to recommend to patients is wearing a continuous glucose monitor, and that gives you a little bit more data over a couple of weeks. And you can just see, like, maybe overall your blood sugar is okay, but you might be kind of self-sabotaging here and there by eating foods that are healthy, but they're just your body doesn't process it. So it's still causing like an insulin spike. But overall, your body's still able to like on a whole regulate your blood sugar, but you're still having these random insulin spikes. So insulin is like a really early test to speak to metabolic health. So it's also going to be affected way earlier than your A1C, which is another reason why I don't like that primary care does not check fasting insulin because things can be picked up a lot earlier. Triglycerides, I would ask that patient too, like what your triglycerides were. Again, those can vary depending on if you're fasting or not a little bit, but they're also a great metabolic marker because if they're over 75, then you're going to also have insulin resistance. Okay, so your triglycerides, I just saw that, are 238. That's pretty high. So you probably got some insulin resistance. Can she write what her insulin level was? I'm just
Yeah,
curious.
probably. Yeah, she can. Absolutely. If you have your insulin level, post that as well. Marcy says she's desperate and considering GLP-1s. Do you want to give any thoughts on that?
I love them. I do. Actually, for inflammation, even like if I have a Hashimoto's patient, I do love LDN, and I think people should be on it because it helps with inflammation, it restores the immune function, which GLP-1s don't really do, but they are huge for decreasing inflammation, actually much faster than LDN. LDN takes a little bit of time to work, but if you want to get some inflammation down and get your antibodies reduced, sometimes the GLP-1s can be really good at doing that. And a lot of times this is when I'm doing like really tiny, tiny doses. It's not a weight loss protocol. It's not the same as weight loss dosing. Now, you can still lose weight when you're doing little tiny doses of a GLP-1 because again, a lot of women are gaining weight or holding on to weight because they're inflamed.
Mm.
So if you're treating the inflammation, you're going to then see weight loss. And just like Meredith has said earlier, though, it might take a while, but you'll get there and you're going to get to a point, you're going to go about it in a way that you're going to also be able to keep it off. And you're going to look good. You're not going to look skinny fat. You're going to just look good. Nobody's going to even know you're on a GLP-1, right? That's what you kind of want. I mean, no shame. I don't mean to sound like they're shameful. They're not, but I'm just saying, like, you're going to look good and it's going to stay off.
Mm.
Well, and I think the way I look at it, and people have asked me all the time about this because, as somebody who is, forward facing, people will say to me, "Can you believe so and so is taking this weight loss medication? Look at them," or they're lying about it. They're whatever. I don't give two shits what somebody else does.
Yep. Mm-hmm.
If you're doing it under a doctor's care,
Yeah.
with getting labs done, great. Godspeed. My husband is on tirzepatide.
Mm-hmm.
Okay. The man, if somebody would pay him to eat for a living,
Yeah.
that's what he would do because he has never felt full in his life
Sure.
until he started a GLP-1. And thank the Lord, because his brain does not say you're full, stop.
Mm-hmm.
It doesn't. His triglycerides are high. His cholesterol was getting out of whack. His A1C wasn't great. He's pre-diabetic. And I'm like, you're 46, man. You got to hang in for the long haul here. Okay. So I have to give him his shots because he's a big baby, but twice a week, because we split his dose. I just asked him before he left, I was like, pull your pants down.
Mm-hmm.
Like, you need your shot. But it has made a marked improvement. And he actually cried the first time he felt full because he was sad.
Yeah. Oh,
But
yeah.
but I was like, you should feel like you should know that that's enough now. Like you've eaten and you've had your share. So I think it's such a useful, important tool now that we have access to, like utilize it.
They're great. And there's like so many women. I have a lot of patients that are on like teeny little doses and they just feel better on them because again, like inflammation is the problem with everything. Everything comes from inflammation.
Mm.
But yeah, your husband probably just feels better because he doesn't have to think about food all the time. Like he probably just feels free and has even more energy just from not thinking about food, which I hear.
Oh, well,
Yeah.
he loves thinking about food, but I think that he's just made some really good gains in being able to this. He doesn't work out as much as he should, but the workouts he is getting in, he's getting a bigger gain out of them because he's got the GLP-1 and he's had fewer bad food cravings is what I'll say.
Yep. Yeah. There's definitely lots of non-scale victories with GLP-1s.
Yeah.
Yeah. Sarah mentioned also talking about alcohol and other addictions too, which is kind of
Yes.
an
Yes.
interest.
That they have been showing to help decrease alcohol cravings. Yeah. LD can also help with that too. Yeah.
Mm. Okay, so does a hysterectomy change Hashimoto's or thyroid function at all?
Great question. It depends on if it was a full or partial hysterectomy. So full just means that they took your uterus and ovaries out, in which case, yes, you immediately go into menopause. I'm going to assume this person is probably asking about a partial where they're just taking the uterus out, but you still have your ovaries.
Yeah, she's going to get one in September.
Oh, you're good. Okay. So you're gonna still cycle. You just don't know, you're just thrown off because you don't have that objective measure of a bleed, a period bleed. But you're still gonna have these ups and downs to your estrogen and progesterone. And I can speak to this personally because I've also had my uterus out, been 8 years now. So you feel a little bit like, I don't know what the heck's going on, but you are still gonna cycle. But they are saying that it can potentially put women in menopause a little earlier, on average, I think 4-ish years, because you are removing a big blood supply to your ovaries. So I would encourage you to get blood work at least yearly, or obviously more frequently if you end up needing some hormones, but just to kind of take a peek. So then the objective measures of your FSH and LH, so those are your brain hormones, become a little bit more important and kind of another more reliable way to see if you're kind of closer to menopause, because we don't have that other objective measure of like what's going on with your periods. If that makes sense.
So I had a partial at 38, and I can tell you for me, by the time I was, so I'll be 45 next month. So by the time I was 42, going maybe 42, 43, I was full-blown
Menopause.
full-blown menopause, panic attacks, to the point of like when I met Katy, the mess that I was the day that I met her, crying uncontrollably in the middle of a work Zoom. Like, get your life right, lady. It was, so that's, between 38 and 42, it was just like the house was on fire. Like, and it was bad. And I can tell you now, at going to be 45 next month, this is probably the best I've been since ever.
Yeah, I'm the same. We're the same age, and I feel the best now I have in a long time. But it's, yeah, but
So
I'm
it's
doing.
great. Like, yay, hysterectomy. Like, that was a wonderful eviction for me.
I got to have a period, but it does kind of
But
like,
it,
you're like, I don't know what's going on.
yep. So you're going to have to, I would just say, stay super on top
Yeah.
of your labs
Yep.
and
How
speaking
you
with your
feel
doctor
and
and
how
about
you
how you feel.
feel. Yep. And don't just like discredit how you feel and throw it under the rug. And if you see somebody that is doing that to you, then find somebody else or come see us. But yeah. Yeah, I got mine out at 38, and I was a complete mess by the time I was like 40. Like, yeah, I'll tell everybody progesterone saved my marriage.
Mm.
I literally thought I was
I
going to kill
love
my,
progesterone myself too.
like, this guy is, we're not going to make it.
Yeah, I'm right there with you. I told Katy, maybe it was when we were on the podcast with your husband, like, Joy Wellness saved my marriage. It saved my life.
Mhm.
It got me, thinking like a logical human being again. So, and all of this is connected, and everybody is just like, well, it's my thyroid. Well, if it's your thyroid, then it's your hormones. If it's your hormones, then it's this. It's all connected. This is a good question too, though, from Kimberly. She did a round of tirzepatide and was advised to take a break, but since she hasn't been using it, her legs are swelling again by the end of the day. And it was not swelling at all when she was on the tirzepatide. It did help my liver numbers too. Would doing LDN be a better choice if inflammation is my main issue?
I'm curious why she was asked to get off it too, right? I don't
Do
know.
you normally take breaks, or that's
I mean, you can, but
A short
yeah.
break, but after 1 month sounds pretty short, right? She said she had been on it for a month or
well,
longer.
she said just a round of tirzepatide, so I don't know
Oh,
how
like a pill maybe or something.
She
two
was,
months.
oh wait, that was somebody
Oh,
else.
someone else.
Oh, yeah, no, you're right. She took it for 2 to 3 months and then was told to take a break.
Yeah, so I would say it depends on what your dose was, what you were on it for. I mean, I have a lot of women, and I will tell you guys truthfully too. I'm also on a little tiny dose. I do tirzepatide. Like every other week, I'm on a teeny little amount, just to kind of keep inflammation under control. I do not want to lose weight. I'm very happy with my weight, so I'm not using it for that, but I just feel great. And like I said, my inflammation's down. So I would
Great.
say it depends on what you're using it for. But if you feel better on it, there's lots of ways to bring it down to doses that just make sense for whatever you need it for. So obviously, you have inflammation if you're swelling and you feel better. So I would say, I would think it would be okay to go back on. I mean, I don't want to give like specific medical advice on this, but anyway, it seems like that kind of makes sense. But yeah, low dose naltrexone can help, like I said, with inflammation. But GLP-1s are amazing for inflammation. But again, they have to be done correctly. They can also not be helpful for some people if they're not done right.
Great. Um, We have some other questions. We had some that came in earlier too. I have a comprehensive panel that I did with someone else. Can someone recommend a protocol? Absolutely. You can send us your labs and we can hook you up with a clinician appointment to go over any labs that you have. So that's fine. We can do that. How long do you wait after you have a baby to get your labs checked?
Great question. I would say, I so Um, if you're breastfeeding, then obviously sometimes it's going to take a little while for your cycle to return. But ideally, your cycle, if you want to know kind of where you are with your hormones, it's best to wait until you've had a couple of periods. And so we can sort of evaluate that. Um, I will say Hashimoto's does tend to kind of present itself a lot after women do have a baby. Pregnancy, delivery, um, can kind of flare that up just because your immune system is so suppressed during pregnancy. So a lot of women are a little bit more at risk to develop autoimmune disorders after that. So if you're feeling a lot of symptoms of low thyroid, like a lot more, I'll have women say like, I'm tired, I'm more tired than I've ever been. It's not like my normal tiredness with this baby. Or their anxiety is a lot worse than it was previously, things like that, then it makes sense to maybe get your labs checked and see if you do have Hashimoto's, because there are things that we could still do even if you are breastfeeding. Um, Otherwise, if you're really wanting to know like what your estrogen, progesterone, testosterone are doing, it's better to wait until your cycles have come back. Well, hopefully that makes sense. So I would say it just depends on kind of what you're looking for.
Yes. Okay. Jolene has a question in the Q&A that I missed. So she's got intense brain fog, it looks like.
Okay.
Other than that, no other symptoms. She's active, so she does get tired from that. She got her blood work back from y'all. I love the y'all. I'm in Nashville. TSH is 2.36, thyroid globulin antibody is 3.6,
Okay, so that's
peroxide
elevated.
38, T3 2.1. Is this why I can't get my brain back?
Yes. Yes, that's way low. Yeah. Yeah.
Okay. And maybe it
So
looks like some inflammation too.
yeah, so you have Hashimoto's. So your T3 is pretty low. So you would even, and if you're pretty unhappy, pretty symptomatic, like you would be a person that we need to work on gut health for sure. That's probably also contributing to the brain fog, but that's a really low T3. So you would be somebody that I would potentially consider being a little bit more aggressive with thyroid replacement right out of the gate. Now, if that wasn't something you wanted to do, of course, we could lean more into you know, really just focusing on rehabbing the gut, get a little bit of LDN. Maybe you want to do some food sensitivity testing to see, what's causing that inflammation in the gut, things like that. But yes, that it's probably gut health and your low thyroid that's causing the brain fog,
Hmm.
be my guess, without looking at anything else and talking to you.
Are artificial sweeteners, particularly stevia, bad for inflammation?
Um, I would say it depends on who you ask. But I would say in general, artificial sweeteners are not ideal. But that one supposedly is better than some, that one and like monk fruit, but I wouldn't say that's my expertise to answer. But
Totally fair. Okay, where are you licensed in? I think Jolene wants to see you. She's in
Oh.
South Carolina. That's kind of a hard
um,
state for us, isn't it?
yeah, I am getting closer to being licensed in South Carolina. So all
Oh,
of my
great.
um fingerprints and everything they want are in. So it's just a matter of whenever they process that. So it's in the works.
Oh, good. Good to know. Where else are you licensed? You're licensed in a bunch of states, aren't you?
Yeah, a good amount, but I lost, I don't know.
Are you licensed in Florida, right?
Florida, Alabama, North
Okay, so you could
Carolina.
see Meredith too, get her on some
Yeah.
LDN.
Yeah. Oh, sorry. It's raining here. So the dog is having a panic attack.
My
Oh,
dog gets so scared of that too. I thought it was just mine. Is that normal?
Oh my gosh, they're both going crazy right now because it won't stop raining.
my
But yeah,
brother's like that. Yeah, it's so sad. It's the worst. I have a 5-year-old dog. Oh, she's usually right me. She's on the porch sleeping outside. Um, but yeah, she's not there. I hope she doesn't develop it, but it's the saddest thing. Yeah, my brother.
yeah.
It is sad.
But I,
We
I
have some more.
definitely want to hear more about this because I would love to get on that and see the effects and talk to all my people online about that as because I don't know why I guess we haven't touched on that yet, but
Yeah,
it's
so
it sounds like me because I'm a huge person in terms of inflammation. Like that's like
yeah.
my
Yeah,
thing.
some women really are just more prone to inflammation. Like you can be doing all the things. I mean, your diet is perfect. Your all of your products in your house are toxin free and like all literally all the things. And you can still just be inflamed and it stinks. But so sometimes you do have to be more aggressive on how you're managing your inflammation with outside sources. Some people are not like that. Of course, women, I would say in general, are more inflamed than men. Go figure, like everything. We get the short end of the stick. But yeah, it's not immediate. I would say that's where GLP-1s, if you want like a faster get my inflammation down, they're gonna come in and you're gonna see numbers move. Like if you're a data person, especially, you're gonna see your inflammatory markers move faster with a GLP-1 than you are with an LDN. Like I said, the biggest benefit of LDN is that restoring proper immune function, which is a huge part of Hashimoto. So sometimes being on both, but it does take LDN longer to work. Yeah.
Mm.
Like,
Yeah, I tried it myself. It's like you
yeah, it
start
takes a
slower
while.
at a slow dose and then you kind of work
Yeah.
up.
And now some people will say they feel better sooner than others, but sometimes it's 3, 6 months before you're gonna like feel less inflamed, if that makes sense.
What markers are we testing for inflammation? Maggie's asking.
So, well, I mean, we do a full white blood cell count, so that can give us some indication. We do a CRP. On the comprehensive, we have a sed rate CRP, we have a homocysteine, we have a uric acid. I think those are the big ones. But yeah, on the advanced panel, I know we did the CRP and then the weight count, obviously, a full weight count. Yeah. I might be forgetting a couple, but we do try our best to look at that.
That's okay. That was kind of on the spot question.
No worries.
You're doing great.
I should know it. I mean, I look at a million labs every day, but anyway,
Okay, I think we mostly answered everything.
okay, great.
Is there any other questions? Missy's just increased her LDN. I'm also okay. That's awesome. Birth control curious. I don't know what are you curious on? Birth control curious. My question was missed. Well, let's see. Let's see if we can answer that one. It was the first one. Okay, I'm going back. Sorry about that.
Oh, I just saw another one come in. Timing of last dose of thyroid before. Oh, are you going to ask before labs? I'm glad you brought that up if you're asking that. But even if not, I'm going to talk on that because it's really important. So if you are on T3, meaning you're on Cytomel or Leothyrono, or Trirostat, that's another brand name for T3 medication, or if you're on natural desiccated thyroid medication, which is like your Armour, MP thyroid. So some T3, you want to check your T3. You want to get your labs done actually after your morning dose. It has a faster half-life, just like I was saying earlier. So if we check it 24 hours after your last dose, it's going to look like your T3 is lower than it really is when you take it, and you could potentially be overdosed. So super important. I tend to tell my patients that are on natural desiccated, so like an Armour, for example, you can do like 4 to 5 hours after your morning dose. If you're on Leothyrono or Cytomel, usually about 3 hours after you take your morning dose. We're trying to hit it at kind of when it peaks. So I can sort of evaluate what it's doing when you're actually taking it, along with talking to you, and then we can make a safer decision on whether or not we're going to make an adjustment. T4 has a longer half-life, so if you're getting your labs done 24 hours after you last took it, that's okay. But T3, that's not okay.
Okay, I found Venetia's question. She's in New Jersey, or did I accidentally just type that? Anyway, at what point does your thyroid start to misbehave as you approach perimenopause? I feel like something's stuck in my throat. My doctor said my blood work was normal, ultrasound was clear, but during my review with Joy, it seems my levels are low. And
Okay.
also put on 20 pounds with no logical reason
Yeah,
earlier
that
this
sounds
year.
like you might have an issue. Um, yeah, so I would say thyroid in general, thyroid disorders are way more common in women than they are men. They are also way more common in women over 40. Um, and yes, I'm sure that has to do with its relationship with our other hormones that are also starting to kind of become a little bit more deficient or go a little bit more haywire. The other reason that a lot of people more and more are struggling with low thyroid, not to be a Debbie Downer, is we got a lot of things in the environment that also don't like our thyroid and we're having trouble like producing or converting, and it all kind of goes into play. Primary sites of conversion are some at the tissue level, the liver, the gut. So again, like Meredith was saying, things really are all intertwined, and there's a lot of things outside of our control that are also impacting our thyroid's ability to function, either from a production standpoint or at the cell level.
So how much can supplements help? So labs show low vitamin D, B, prolactin. Will improving those improve thyroid?
Absolutely. Like, especially if you're kind of more on the conservative side, you have some symptoms, but you feel like for the most part, like you're managing all right. I would say absolutely. Like, if your iron is low, your B vitamins are low, your vitamin D is low, 100% start there and see if that makes a difference. Like, iron, vitamin D, B vitamins, um, selenium, zinc, iodine, which iodine's kind of a little bit controversial, but a little bit of support there. You don't want to go too much. Um, um, there's other vitamins and minerals too that can impact, and sometimes they really are enough. Um, Again, assuming that you're kind of dialed in on nutrition, you're decreasing your inflammation, like you're kind of taking care of yourself. Everybody should be doing that anyway, obviously, instead of just relying on the hormone to do all the work. Like you're going to respond a lot better to any hormone if you also have your lifestyle in check and sleep and all of that. But yeah, it can be a good place to start. There again, it depends on how symptomatic and how low you are. If somebody's like in the two, like I'm just gonna give an example. This is not like black and white people, but like if your T3 is like 2.1 or 2.5, like I don't know if vitamins are going to do it. And you're pretty symptomatic. Like, if you were seeing me, I would probably definitely have that conversation. Like, if you're pretty miserable, I'd probably go ahead and start some thyroid replacement if you were open to that. Again, if you're really anti, like, of course, we can try to like really get those vitamins going and see what happens. But I don't see them bringing your thyroid from a 2.5 to 3.5. But, I don't say never. It could.
What are thyroid nodules and how can you help decrease them?
Yeah, so that a lot of times they're just like benign growths, and sometimes people have nodules that are small enough to where they're not really impacting um the thyroid gland, and so people will just watch them. Sometimes they're large enough to where they are really impacting the function and you need to get them removed um surgically. Yeah, but not necessarily the entire gland out.
Mm.
Yeah, but they're growths and again, depending on the location and size, can impact thyroid function. Sometimes they don't.
What about overactive thyroid? Do we treat that differently?
Um, we don't do a lot with overactive. There is some medication that you can take. So I actually the other day I did have somebody that does appear to have Graves' disease. So her thyroid numbers were above normal range. She was not symptomatic, and she had some antibodies. So initially, you can sort of approach Graves and Hashimoto's similar. So they're autoimmune. So like LDN can be a good option. Looking at the diet, removing again gluten, dairy, things like that. And sometimes that's enough to sort of calm the thyroid down, and it'll kind of act like it's supposed to. If you're really symptomatic with Graves, like you are sweating a lot, you're losing a lot of weight, you have a lot of loose stools, heart palpitations, anxiety, I would say you're probably, you need to see an endocrinologist. The downside is that sometimes the approach is to completely wipe out the thyroid and then you become hypothyroidism, which is a little unfortunate. I feel like there would be a little bit better approach, but that's not something that's currently we're offering at Joy right now. Yeah.
Okay, great. And so I think one last question. What
Yeah.
causes T4 to not convert to T3 when everything else is optimal?
Yeah. So sometimes it's your liver needs a little love. So even if your enzymes are normal, it doesn't mean that your liver isn't struggling. Our liver clears a lot of things that we can't see or touch or smell, so it's constantly working. So, reducing your toxic load, number one, is going to help because then it can prioritize other functions like converting T4 to T3. And if it's not having to break down other toxins, it's always going to prioritize that. So, one of my favorite websites, if you are not familiar with it, is Environmental Working Group, and they will help you evaluate personal care products, cleaning products, things like that that you have control of for like a toxic load. Um,
Mm.
so making sure your liver is healthy, you can take some supplements or you can do like castor oil. There's lots of things to kind of help it function better. The other thing could be poor gut health. Your gut is another site of T4 to T3 conversion. So, especially if you've got bloating or constipation or reflux or, upper GI pain, diarrhea, like pretty big sign you've got something going on in your gut that we need to figure out what that is, whether that's a food sensitivity, some bacterial overgrowth, what have you, that can impact conversion.
I think
Um,
that answers Nance's question. She's saying if you're trying to figure out your health, your gut health, would you recommend doing like a food sensitivity or to find
yeah,
out?
yeah, yeah, they can be helpful. For sure. So, and then just in general, like if you're going through a lot of stress, like you've got whether that's mental, emotional stress, but it also can be physiological stress. So there again, like if you have insulin resistance or something else is causing a lot of inflammation at the tissue level, you're not going to convert. You're going to bank it to something called reverse T3, which we didn't really get into, um, but those are like common reasons that you don't convert. Yeah. Hopefully
So
that.
Okay.
what's an optimal T3 uptake?
So, um, I like to see it at least 3.5. In general. I mean, that's a very like blanket statement. It really does depend on the person, but I would say at the
And all
very
the other levels, because you can't look at one without looking at the others.
right. I mean,
Got it.
in my opinion, T3 is the most important because that is the most powerful in terms of how somebody feels. Like, because you can have a great T4, but if your T3 is not good, you're not going to feel good. Same with T8,
Interesting.
TSH. TSH also drives me crazy. Like, just because it's normal doesn't mean it's not your thyroid. That should be a take home message. Okay.
That
Okay.
is what we are going to.
So anybody who's in our age group that's sitting in here in that middle age, middle 40s or inching towards 50s, the full thyroid panel workup is a necessity.
100%. I
Okay.
don't disagree. Yeah.
Okay. All right. That was my last question on that because I was actually sitting here going through my old labs. And I'm wondering myself because I don't think I had the full thyroid on my last one, so I think I'm gonna have to add that to because I can't even see what my T3 was.
Yeah. Yeah.
So I need to
Yeah, we
order
can
that.
add that one on the next one for sure.
I'll see you, Meredith. You can come see me.
I think it's so interesting because you're looking at dissecting so many different parts of you talk about the layers of an onion. Good grief.
I know.
Yeah, and I think that's, again, I think that's why it's hard to get thyroid like find people that are comfortable. Like you have to respect people that are like, I'm not going to test that because I don't know what to do with it. They don't want to be unsafe. So it's not, again,
Right.
it's not that they don't care. It's a little frustrating that when you have a female that's complaining of the same symptoms over and over and they just keep telling them like, I don't know, or, maybe at least acknowledge that maybe something else could be going up wrong and just instead of saying like, that's just how it is, like that part is frustrating. But
Yeah.
again, like you do have to like respect that they're doing what they're comfortable with. And like I said, if you had asked me, 10 years ago if I was this comfortable with thyroid, I would have told you no. But I took it upon myself to become comfortable because it's really important. And I personally also was one of those people that was falling asleep at like 7 o'clock with three young kids. Like you can't do that. It
Well, and
doesn't
you've
work.
just become an advocate, which is great because you
Yeah.
found your passion. And, people may laugh because you're like, oh, your passion is thyroid. It's like, I think that's great. Like, my passion is laundry. Like, who's passionate about laundry, right? Like, but whatever your passion is,
Right.
that's you're going to go and you're going to go the extra mile and you're doing that for your patients. So I applaud that.
Yeah. Yeah.
All right. Well, thank you guys. We're a little bit over. We're going to send this to everybody in an email so you can watch it. You can see a summary. We'll send the optimal levels. Kim is licensed in a bunch of states, but if she is not, we also have some other great clinicians who also
Yeah.
know
We do
about
have,
thyroid as well.
yeah, we have do have some on our team that are as knowledgeable as myself. So yeah. Hmm.
Yes. And thank you, Meredith, for sharing all your details of everything. I love how open you are and honest you are about everything, and we love having you here. So thank you so much for joining us, everybody.
I love it. I told you that I'm a forever joy, so I'll scream it from the rooftops. It's made such a change in my life I think it's great. And if my husband were sitting behind me at his desk, he would scream over and say, "Thank you, thank you, thank you,"
Right?
because it
Yes, because it helps them too if we're better.
yeah, no, he credits it, he's like, "Thanks to Nancy, our therapist, and Joy."
Yes. Yeah. Yeah, I think I said this, but thyroid's big with libido. Like it's not just testosterone, it's your adrenals, thyroid. They are huge players with libido too. Big, big time. Yeah. So
Meredith's good now. We've seen that.
yeah, so
All
I mean,
right.
we can
Thank
talk
you.
about thyroid forever, but hopefully I answered most questions and you guys found this helpful. But yeah, I'm super passionate about empowering people. It's why I like Joy. You can go and, order your own blood work and be like, forget it. I'm not getting answers somewhere else. I'm going to just take it in my own hands. So my goal is for my patients to be almost as educated as me or as educated as possible so that they can make informed decisions about their own health and invest in your health because it's the best investment you can make.
It
Oh,
is.
love that. Thank you. Thanks, everybody. Have a great weekend.
You too. Bye.
Bye.